Hello everyone, I am Jocelyn, the AI news anchor of News for Chinese. This program is sponsored by Hoyear LLC. A medical office in Redwood City is for sale. It has an indoor area of 3,200 square feet, 9 rooms, and a large hall that can accommodate up to 120 people for gatherings. The property is located in downtown Redwood City, just 5 minutes from Kaiser Hospital and Stanford Medical Center. For inquiries, please call 408-471-7298, 408-471-7298.
A study by the National Institutes of Health suggests that people who consume insufficient amounts of water are at a higher risk of developing chronic diseases and are more likely to die at a younger age. Inspired by previous research on mice. This study, published in 2023, was inspired by previous NIH research that examined the long-term effects of water restriction on mice. A 2019 study found that chronically limiting water intake in mice shortened their lifespan by approximately 6 months, equivalent to around 15 years in human lifespan. Exploring the link between hydration and aging. As a follow-up, the researchers aim to determine whether optimal water intake in humans influences health and aging. To do this, they analyzed data from a long-term cardiovascular health study that began in the late 1980s. The study included over 15,000 participants, with an average follow-up period of more than 25 years. Researchers examined serum sodium levels in blood samples to assess hydration levels as a proxy for water intake. Serum sodium levels have long been considered a reliable indicator of hydration status in healthy individuals, with normal levels ranging between 135 to 146 mmol. Chronic dehydration is often associated with elevated serum sodium levels. Key findings: hydration and biological aging. The study found a significant correlation between higher serum sodium levels, above 142 mmol, and accelerated biological aging. More specifically, participants with serum sodium levels above 142 mmol had a 15% higher biological age compared to their actual age. In participants with serum sodium levels above 144 mmol, this figure surged to 50%. Chronic disease and mortality risks. The study also linked high serum sodium levels, above 142 mmol, with a 64% increased risk of chronic diseases, including heart failure, diabetes, dementia. Furthermore, participants with the highest serum sodium levels, 144.5, 146 mmol, had a 21% higher likelihood of premature death compared to those with the lowest levels. Correlation versus causation. While these findings highlight an important association, researchers caution that correlation does not necessarily imply causation. The study does not directly prove that reduced long-term water intake causes shorter lifespans. Joann Fabric and Crafts declares bankruptcy. The Bay Area's craft community is facing a major loss as Joann Fabric and Crafts prepares to close over a dozen local stores, eliminating a long-standing creative resource in the region. Joann's store closures are part of the company's Chapter 11 bankruptcy proceedings. The retailer has filed a motion seeking court approval to shut down approximately 500 locations nationwide. The planned closures will affect cities both large and small across the Bay Area, leaving a significant gap in the local supply network for crafting materials. This situation is worsened by the recent closure of Fabric Outlet in San Francisco's Mission District, an independent supplier that had long served fabric enthusiasts. Company statement on the closures. Joann spokesperson Amanda Hayes acknowledged the difficult nature of this decision in an official statement, emphasizing the impact on employees, customers, and the communities the company serves. She stated that store performance and strategic alignment were key in determining which locations would remain open. As Joann scales back its presence, the crafting community will need to seek alternative sources for fabric and supplies, facing challenges in sustaining their creative endeavors. California Senator proposes stronger measures against wage theft. To combat wage theft in Santa Clara County and across California, State Senator Aisha Wahab D. Hayward has introduced new legislation aimed at enhancing enforcement and increasing penalties for businesses that fail to pay court-ordered wage theft judgments. Key provisions of Senate Bill SB 261. Sponsored by Santa Clara County, SB 261 proposes the creation of a public database listing businesses with outstanding wage theft judgments. Additionally, the bill would allow employees and civil prosecutors to receive reimbursement for legal fees incurred when taking legal action to recover stolen wages. The legislation targets persistent issues affecting low-wage workers in industries such as restaurants, hospitality, construction, and healthcare. These violations include unpaid overtime, stolen tips, minimum wage violations, denial of meal and rest breaks. The Civil Prosecutors Coalition, a co-sponsor of the bill, has emphasized the growing concerns surrounding wage theft in these industries. Senator Wahhab's call for action. We must do more to protect working people from employers who exploit them, Senator Wahhab stated. Wage theft is one of the most common forms of crime, and we need to act now to strengthen enforcement, ensure victims receive their wages, and hold offenders accountable.